I'm feeling okay. Welcome to the Stream Home Edition. Today we are looking at coronavirus and refugee settlements around the world. How is it impacting them? With the help of three guests, we will look at the current conditions where they are working, the challenges of handling COVID-19, and what help do they need. I know you will have questions for them. So, you know what to do. We have a YouTube conversation. It is live right now. If you have questions, you have concerns about refugees, wherever they may be around the world, our lineup is more than happy to tackle your questions. If you've got stories and anecdotes, love to hear too, and you too can be in the stream. I am going to say hello to the guests. The guests will introduce themselves to you. Francesco, good to have you on the stream. Tell our international audience who you are and what you do.
Thanks, Temi. Good afternoon, everyone. My name is Francesco Bert. I work in Jordan for the UNHCR, the UN Refugee Agency. I've been working here for almost 3 years now, and with UNHCR for almost 8 years. So welcome,
Good to
everyone.
Nice to have you. Dr. Chima, great to have you in the stream. Tell our audience who you are and what you do.
Hello, good evening from Islamabad, Pakistan, and I'm the country program director for ALIGHT, American Refugee Committee, and we have been working with refugees in Pakistan for now almost 18 years.
Great to have you. And Abdullahi, it is extraordinary that we have you live on the stream right now because you are in Dadaab camp in Kenya. So we're happy that we are connecting with you live. Abdullahi, tell everybody who you are, what you do.
Thank you, Fema. My name is Abdullahi. Greetings, good evening from Dadaab town. I am a refugee journalist who is actually based in Kenya, Nairobi, but quite often attached to the Dadaab refugee camp. Here in Dadaab, I run two charity projects. That is, one is an educational to support refugee youth with books. I started this project 3 years ago, and we're starting a library for the refugee youth. I also run a radio show to help the refugee communities here in Dadaab and their hosts to get informed and debunk rumors about coronavirus that have started early this year.
Abdullahi, it's great to have you. Thank you so much. Guess I want to start first of all with just setting the scene for where you're working, the conditions where you're working. Francesco, I'm going to show this picture here that you shared with us here at the stream. Can you explain what's going on? Where are we?
Yeah, I think that's a pretty good picture because we are in a camp, in a refugee camp in Jordan. This camp is called Zatari, and it's home for about 80,000 refugees. It's actually one of the first camps that was set up at the beginning of the Syria crisis, so in 2012. And since then, we are entering now the 10th year almost of the Syria crisis, and we still have a very huge population of refugees that live there. It's quite symbolic because it shows that 50% or about 50% of the population in that camp is made of children below 18 years of age. So those are, and it's quite interesting what Abdullah said, because one of the biggest challenges is education for these kids. And this is not just in Zatari camp, but it's throughout Jordan. Jordan hosts about 660,000 Syrian refugees, and that's just a part of the whole refugees that live in Jordan. Consider that about 1 in 4 of the individuals, the population living in Jordan, is a refugee or has a refugee origin, which makes Jordan the second biggest refugee hosting country per capita in the world. That gives you an idea of the size of the crisis, and that also gives you an idea of the challenges that we face as UNHCR, right, but also with our partners when we work to try to support them to thrive during their time in exile.
So that's a beautiful way to set the scene for where you're working right now. Dr. Chima, you also sent us some pictures. I'm going to show this one, and you can tell us where we are and what's going on in this picture. Dr. Chima, if you have muted yourself, do you want to unmute yourself? Because we can't hear you. I see your mouth moving, but I don't hear anything.
Yes,
Please
can you
continue.
hear me?
Yeah, we hear you now. Start again, Dr. Chima. Where are we in this picture?
Great. Well, as you know, most of the refugees in Pakistan are engaged in the day labor. Day COVID lockdown has really impacted them very heavily, and for them to have a meal on the table has become very difficult. Hence, dry food distribution to the refugees be one of our priorities to make sure that they are not face to face to food insecurity. And these two pictures, in fact, are where we have been not only going to the doorsteps of the refugee villages, distribute them food, but also the patients or refugees who have come to the hospital, another hospital that we have been running. We were providing them not only medicine, but also the food packages.
Mm, thank you for that. There was a sense of anxiety for refugees and also the people who work with refugees around the world when we became more when we knew more about COVID-19 and its spread. Back in May, Malcolm Webb, who is an Al Jazeera correspondent, was reporting from Kenya and explaining the situation there. Let's take a look at part of that report.
Anna Radio fled fighting in her hometown in South Sudan when she was 2 years old. Her parents brought her here to Kakuma refugee camp in northern Kenya. It's been her home ever since. She's worried about the spread of the coronavirus in the camp.
Where we fetch water, we have to queue, and social distancing is practically impossible. That scares me.
But refugee rights activists say cramped conditions and the lack of healthcare could be a recipe for disaster.
Unfortunately, it means possible devastation. People who are infected will not be able to be isolated. People who, there'll be a lot of transmission. The spread will be fast and the response will be slow.
Abdullahi, that was a major concern. I am wondering in Dadaab, how prepared were you for COVID-19 and what is the situation right now?
Thank you. I think no one was prepared for COVID-19, not only the Dadaab refugee camp or any other refugee camp in this world. Ideally, the coronavirus caught us in a very unprepared all over the world. More so, it is even worse in refugee camps where services are limited, where everything is being rationed because everything is about what you're given. Everything that comes to the refugee camp is something or a support that is given by the UN, the UN Refugee Agency and the UNWFP. Food is rationed. People queue for food. People queue for water. People queue for all aid supports. So this tells you, ideally, as the social distancing thing, that is the magic way of preventing COVID-19 is not possible. Like when you queue for everything, the aid agencies like UNHCR is doing its best to safeguard this and implement this method, but understaffed agencies, because people working from home, it's a bit challenging. Water is also challenging. Water is rationed as much as water was increased during the COVID-19 by the aid workers. Still, the challenge is there because we're talking about a community that goes out and queue for every services that they get from the aid agencies. So it is a really very tough time.
Francesca, I'm just wondering that none of that sounds surprising to anybody who knows the refugee situation in Kenya. If we move to Jordan, though, can you tell us what the preps were and how people are doing?
Absolutely. I think it's quite interesting because as much as I obviously sympathize with what Abdullah just said, we had a very narrow window of opportunity here in Jordan. And we were in a way lucky because we could see what happened in Europe. So we have about a week to 10 days to prepare. And I remember those 10 days in March were hectic, of course. But those were the days where we put in place the possible response, the best possible response. That was not just UNHCR, of course. That was a discussion with our partners. That was a discussion with the Minister of Health here. How do you actually make sure that we have the stock in place inside refugee camps to make sure that refugees can access that when they need it? How do you make sure that you put in place a system whereby refugees can maintain social distance when they're queuing for their services, as you said? What happened was that in those 10 days, we step up the response. And then when the lockdown actually happened in Jordan was quite sudden. So from one day to the other, as Abdullah said, we were all working from home. But there were some colleagues that actually decided to remain in the refugee camps and live there, literally live there. So they spent the first month and a half of lockdown living with refugees, making sure that essential services were provided, health services, but as well as food distributions, and making sure that the lockdown was respected. At the same time, the key message was to pass it to refugees that you need to respect those measures because it's your own health, it's your own well-being. And so, in a way, in Jordan, we're very lucky, and also we were very well prepared to address the situation in the best possible way.
How many refugees do you know had either cases of COVID-19 or even tragically passed away from COVID-19? Do you know those figures?
Clearly, we again, it's part of, I think, of the response. Since the response was well set up and well coordinated, we were lucky enough, in a way, to have no cases among the refugee population, and no cases in the camps, particularly, because as Abdullah said, that was the main risk. Congested areas, the spread of the virus could happen very fast. So we were quite lucky that that didn't happen. So we didn't have refugee cases, no refugee fatalities. This, you have to put it in a context whereby in Jordan, the early lockdown that I was mentioning allow for a very low number of cases. We have today, about 3-4 months into the crisis, 1,200 cases and only 11 deaths among the entire Jordanian population. So the key aspect here is that refugees were first and foremost integrated in the national response plan. So in the case that there would have been a case, or there will be a case, a refugee will receive exactly the same treatment that the Jordanian national will. So following the national capacity, the national protocol in terms of hospitals, in terms of treatment. And so, but again, luckily we didn't have that here in Jordan.
I want our audience to meet Dean. Dean is an Afghan refugee and he is based in Greece right now. And he talks to us about the reality of everyday life when you're not able to move around freely as a refugee. Let's have a listen.
The COVID-19 pandemic is impacted people's life very negatively inside Moria refugee camp because this camp is really an overcrowded camp, and thousands of people, more than 15,000 of people are living very closely to each other in a very small hotspot that was designed only for 3,000 people. So it creates too much fear and scare between peoples. But the most worried point is that if the virus get into this camp, it will make disaster. And also this camp is still in quarantine and peoples are not allowed to go outside of the camp. They have to stay all the day inside these tents, inside these hot tents.
Dr. Chima, that's an intense experience that Dean just shared right there. If we looked at the refugees that you are currently working with, how are they faring? How are they doing in their day-to-day life?
The different than seen trees talked about. Over 40 years old refugee settlements in Pakistan. We now 1.5 million refugees in various parts of Pakistan. The good thing is about 1 million of them are living in urban settings. So about 500,000 are living in various refugee. So luckily, like Francesco has mentioned, we did not see many, cases into the refugee settlements in the villages, and people have been pretty much safe so far. But I think their biggest challenge, or biggest crunch, has been economical, because the lot have lost their day jobs, and then because Alight in Pakistan is the largest sector in our children program, and where we have also addressing the education. We are running the country's largest ever out of school children program, funded none other than by government of Qatar, and Educate a Child program. So for us, the situation was very different. We have to make sure that by losing their jobs, they're not facing the food insecurity. And also all those children that we, with a lot of hardship, have brought into the education system should not be out of the system again. So how you can bridge this gap of learning, and for that, we have on very urgent basis, we started an educational radio program, because most of these communities have no access to power, internet, or gadgets. So we have to start in some other way, which I call was a low-tech, high-impact intervention. I would also like to bring one of the other challenge that refugees are facing in Pakistan is that government of Pakistan handed out a major social safety support across funding to about 12 million low-income families, provide them cash incentive and providing them the function, and about 1.5 million refugees, fortunately, do all into that system. So, I mean, their qualification is not there. So I see that they're having double crunch, one from losing the livelihood, and also missing the opportunity of getting the safety, support, or the, from the social safety support from it. So
Okay, Dr. Chima,
I think
I
that
do
is a
want to share.
challenge, yes.
Absolutely. I do want to share a picture that you sent us, which is, it looks like school with social distancing happening here. Is school happening for refugees in Pakistan as normal? Is every kid going to school? Are they able to go to school? Because this is a major issue for school kids around the world right now with the global pandemic.
Unfortunately, Pakistan hosts a big population of out-of-school children. Over 20 million kids in the country are not going to school, which makes roughly, about 10% of the total population. And I would say the refugee populations are no exemption. Rather, maybe more than 10% of their population of the kids from age 6 to 16 are unable to go to school. Through this program, the picture you just have mentioned was about when our program and our literacy mobilizers were, as well as we encourage the parents to take the radios, have their kids sit them and go through this program regularly basis, which we have transmitted twice a day.
I want to bring in a comment from Jess, who works for UNICEF, and she talks about the ongoing challenges managing COVID-19 and the impact that it's having on women and kids. Let's have a look.
In the past few months, the COVID-19 crisis has had a deep impact on the children and the youth in the refugee camps. First of all, because in order to fight the pandemic, the government of Jordan imposed some strict lockdown measures, some of the strictest in the world. Now that has affected the refugees in camps more than anybody else, and the young people in particular, because the restrictions were only lifted a week ago, which was much later than anybody else in the Kingdom of Jordan. And that has deeply impacted the livelihoods of young people and refugees in general. But it has also obviously impacted the education of the children and their access to psychosocial support and other forms of recreational activity.
A windy day there, but Francesco, you were nodding. Go ahead.
Yeah. I know Jessica well, so I'm glad that she commented on that. It's you can add other figures. 50%. The mental health consultation went up 50% during the lockdown. That shows you that that's just a sign. Domestic violence went up during the lockdown. Those are all signs that the lockdown indeed has an impact on those, and particularly the vulnerable, the women, the kids, including in terms of education, as Dr. Chima was saying. All this was done, though, in a way to prevent the virus to spread. Let's remember that. So there was a bargain that the authorities had to take there. And repeatedly at all level, officials said there was a need to put public health first. And that's what was done. Now, the interesting part is, and obviously now the challenge is clearly an economic one, right? 35% of refugees that had a job before the lockdown, before the crisis, actually lost it. Similar stories. Daily workers, they were the first to lose their jobs. So what they're going to go back to now that the restrictions are slowly being lifted. But I think what's interesting is that refugees are entrepreneurs. They're willing to contribute to their society. I think another great example comes from Zatari, and that's an innovation lab where refugees are actually created some innovative ideas to actually support those communities to deal with the crisis. And the most
Francesca,
recent
do
one,
you mind if I show an example of that? Because when I saw it, it actually blew me away. It's a little clip of a video, and it's really intriguing about an innovation that came from Zatari camp and its way of raising money and funds and economically supporting themselves. Let's take a look at that clip.
فكرة من صناعة هذا الروبوت إنه إحنا نكون كلاجئين مساهمين وموجودين على خط كفاح فيروس كورونا. الهدف الرئيسي من صناعة الروبوت هذا هو كان خدمة المجتمع المحلي اللي احنا منه مجتمع اللاجئين في مخيم الزعتري، وطبعا بالإضافة أنه ممكن يكون موجود ومتوافر خارج مخيم الزعتري.
It's such a positive way of really just challenging some of the stereotypes. I hear you, Abdullahi. Just let me finish my sentence. 1 second. Some of the stereotypes that are attached to refugees around the world, even when we're in a global pandemic. Francesco, let me just very quickly just bring in Abdullahi, because on YouTube, one of the viewers made a note that Jordan is so incredibly different from the way that Kenya is handling its refugee population. Abdullahi, why do you think that is?
Ideally, what I think is that it's also happening in Kenya. What mentioning is that innovations are there. Refugee-led organizations, refugee youth are trying to come up with better means of handling the coronavirus. In the DAP, the refugees who are busy making masks for their fellow refugees through no funding and through the innovations of the high school and of the universities, because everybody is in holiday because of the coronavirus. In Kakuma, they make soaps that is being enabling them to wash or supplement whatever that's given by agencies. Ideally, what I wanted to say is that the crisis is making us harder. The refugee communities are getting hard, and they're getting innovative. In Kakuma and Dadaab, they're already making soaps, face masks, and in other places, even they're more trying to modify or improvise running water system that can supply water to the households. So ideally, this crisis have made refugees part of the solution than more than any other crisis. So innovative is something that is really opening up ways and making life comes better, not only in Jordan but also here in Kenya.
Oh, that's such a perfect place to end. Innovation with refugee communities around the world, even during a global pandemic. Abdullahi, Dr. Chima, Francesco, YouTube audience, thank you so much for joining the stream today. I will see you next time. Thanks for watching, everybody. Take care.